earlier this month, I held a town hall on police community relations. And one of the factors that came up frequently, one we've heard in the Public Safety Committee for many years, is that our police officers are not trained or equipped to respond to mental health or substance abuse incidents. And yet national studies have told us what Chief Manger and Chief Jones have told us for years in the Public Safety Committee, that a large portion of our 911 calls are related to mental health or substance abuse. And a recent New York Times article says that Montgomery County police officers spend 37% of their time responding to non-criminal calls, only 4% of their time on violent crime. So to me, we need to create a much more effective crisis response and crisis care system to provide adequate and appropriate services for our residents who struggle with mental illness. We shouldn't have to do this alone. Like all healthcare, this is primarily a federal and a state responsibility, but we can't wait for them to take action. The avoidable police-involved shootings of Emmanuel Okatuga and Robert White and Fernand Burhi, all in my district, highlight the repeated inadequacy of our current strategy. I've never seen a carpenter or plumber show up for work with only one tool in their toolbox. They always have a variety of tools depending on the challenge they're going to be facing. But if you only have one tool, that's what you have to use over and over. And in most cases, the only tool we have had to respond to residents in psychological crisis is an armed police officer. We rely too much on our police, I believe, to act as mental health professionals, and we need to stand up a much more appropriate system. And there's never been a more appropriate time to do so when the public is expecting this. The county doesn't have the capacity currently to respond to our behavioral health issues. We only have the one mobile health crisis team, a mobile crisis team based in Rockville, and they're simply too far away to respond in a timely manner to most calls involving residents in crises. And when they have to do that, they have to leave the crisis center, which we don't want either. So instead of having only police officers respond, as Councilmember Glass mentioned, I believe we need to have behavioral health professionals placed around the county that can respond in real time. The special appropriation funds, 6 of them to get us started. And equally important, I think it calls on the council and the executive to work collaboratively to establish an interagency work group to develop an enhanced model to address this crisis. Other jurisdictions have effective models. It'll take us some time to bring together our staff experts to figure out the optimal model or combination of models for Montgomery County. But because we know our HR process can take many months, it's important that we're starting today by encumbering the money with this appropriation so we can begin to advertise the positions while we research the data and the options for our approach. I think our plan has to be informed by research and best practices and lots of advice from the community and a thorough analysis of our 911 calls. And it has to be culturally appropriate and include social workers who speak languages other than English. And finally, I think we have to have a community-based approach that includes a lot of the voices of the residents that'll be the most impacted by this. Just to wrap up, I don't believe at all that one special appropriation or one policy is going to single-handedly resolve community police problems or dismantle institutional racism. This is just one piece in the puzzle, but it's a critical piece, and it's very much a start on how we reimagine public safety moving forward. So I'm grateful to all of you for your support and leadership on this, and look forward to working with you on the next steps. Thank you.